Hello, everybody. Good afternoon, and welcome to our next session. It's my very great pleasure to introduce Malaika Ludman, who is a program coordinator with Birthmark Doula Collective. Ms. Ludman is a birth doula herself, and she's a certified lactation counselor who holds a master's degree in public health. She's a program coordinator for Birthmark Doula Collective, which recently merged with the New Orleans Breastfeeding Center. Ms. Ludman manages the Infant Ready Emergency Infant Feeding Program and is a lead coordinator for the Community Breastfeeding Grand Rounds. She also supervises the collective's first cohort of perinatal community health workers. As a mother of two, she recognizes the value in providing all pregnant and postpartum families with equal access to gentle, supportive, and compassionate care. Before becoming involved in community-based maternal health programs and services, Ms. Ludman served as a Peace Corps volunteer in Benin, and later 5 years working for a global nonprofit organization based in the DC area. We're really excited to have you, and I will turn it over to Ms. Ludman.
Thank you so much. I'm going to go ahead and share my screen. Crossing my fingers that technology is kind to us. Okay. All right. So thank you very much for inviting me on behalf of Birthmark Doula Collective to present our experiences in disaster preparedness and response. And thank you, Yulia, for the introduction. And I know that everybody is feeling energized from Kelly's opening remarks. So I'll begin by telling you a little bit about Birthmark Doula Collective. We are a birth justice organization that supports, informs, and advocates for pregnant and parenting people. And we started as a small grassroots organization a decade ago. And at that time, Birthmark was made up of just a couple of doulas providing doula support to birthing people. And since then, we've expanded and offer a variety of services and programs. And earlier this year, as Yulia mentioned, we merged with the New Orleans Breastfeeding Center. So we now offer services to families for birth and postpartum doula support, lactation support, childbirth education, and general perinatal wellness. And outside of our direct client services, we are also involved in community outreach and advocacy. So we have support circles for new parents. We provide continuing education for providers in the community. And because birth justice at its core is an advocacy movement, we also sit on the committees of a number of policy-focused initiatives. Okay, so our emergency preparedness program is called Infant Ready, and we launched this program about 3 years ago. And the best practices that we promote through this program are based on international standards for infant and young child feeding in emergencies. And I will refer to that as IYCFE at times in the presentation because it's a mouthful to say. Our program provides families and their supporters with the tools and information that they need to practice safe infant feeding in a disaster. And so the different components of this program fall under the different phases of emergency management. So in the preparedness phase, we train emergency responders, lactation support providers, and health professionals in general on infant and young child feeding in emergencies. And we also do community outreach with families so that we can educate the community on safe infant feeding options during disasters. In the response phase, we distribute emergency feeding kits, which help caregivers practice safe infant feeding. And we also activate a hotline for families. And we'll get into the details of these and how they play out in just a few moments. And then lastly, we are in an ongoing process of evaluation to figure out what works and what doesn't work so that we can improve our program for future disaster situations. Now, when we talk about our program, it's typically in the context of natural disasters, but our program really applies to any type of emergency. So this can be personal or family crises like homelessness. It can include public health emergencies like disease outbreaks or even acts of terror or violence. So basically any event that can disrupt the public infrastructure and or a person's daily life. So how did we, doulas at the foundation, become involved in emergency preparedness? We are not climate change experts. We are not emergency response planners or managers, but we have worked very intimately with families in various contexts. And we understand that families face very unique challenges and are particularly vulnerable in emergencies, especially families with children under 2 years old. So our involvement in emergency preparedness began with an event at MIT in 2018, which was called Make the Breast Pump Not Suck. And the New Orleans Breastfeeding Center's two co-founders were invited to take part in this hackathon. And this event brought together people from different industries to design products and programs and services that were supportive of breastfeeding. And this is where our co-founders designed the very beginnings of our emergency feeding kit. And this is because they both had experiences volunteering in shelters as nurses after disasters. And they realized that they hadn't seen the physical supplies or the information that families would need to be able to feed their babies safely in an emergency. So they thought about what tools could be useful in our communities to help families be better prepared. And this is when we came up with our emergency feeding kit. The list here is what's included in our kit and what we consider as some of the most essential items for safe infant feeding in the first 48 hours or so of an emergency until a family can access supportive infrastructure. And these items were chosen based on thorough literature reviews, based on conversations with experts, and also with the reality of limited funding. So inside of this water-resistant drawstring bag, we have hand sanitizer and sterilizing wipes, which promote good hygiene and are good for infection prevention. We also have disposable medicine cups, which are used for cup feeding. And cup feeding is actually the preferred medium for feeding a baby when a baby cannot feed at the breast. And globally, feeding using a cup has been shown to be the simplest and safest and the cleanest way to feed a baby. And we have intentionally not included any bottles or bottle nipples or breast pumps in this bag because international guidelines don't encourage the use of these items in disasters when you cannot guarantee clean water or electricity. We also have breast milk storage bags so that a caregiver can express milk and safely store their milk. There is a cooler bag and disposable ice packs to safely store that milk to keep it cool, a permanent marker to label breast milk storage bags. There's a nursing cover to promote privacy, security, and comfort for families in a disaster situation. When you're in rapid transit, there's no telling when you have to feed your baby. You may be in a crowded shelter or on a bus, but having that privacy really helps. We also have an LED light in the bag that's useful if the electricity cuts out, and it can also be used as an emergency flare. We have bottled water to promote hydration. We've added face masks in there for COVID-19 prevention. And we also include an educational booklet that is low literacy. Actually, I have it right here. It's a small, pocket-sized booklet that's low literacy, very visual, and has diverse representations of caregivers and breastfeeding bodies. And it contains essential teachings on safe infant feeding. And this can be used by a caregiver to review and get the information that they need, or an emergency response person can use it as a tool to teach a family about safe feeding. And some of the topics covered include hand expression and cup feeding, safe storage of human milk, and safe preparation of formula. And while these are all items that we have in our kit, we want to make it completely clear that any facility or public health agency can purchase these supplies individually and have them in stock in order to be able to support families. So now that you have some context on our program, I want to share a bit about our experiences responding to two recent natural disasters, and the first being Hurricane Laura. Before Hurricane Laura, our work was mostly centered on training and sharing tools and information. And with this storm came our first ever local response. So we had not activated a community response before, and we learned as we went based on what we had read in the IYCFE literature, based on the conversations with other people experienced in this field, and also based on the gaps that we were observing in real time. So Hurricane Laura was a very destructive Category 4 hurricane that made landfall in southwest Louisiana on August 27th of 2020. And it occurred around the same time as a second wave of COVID-19 in the state. And New Orleans was selected as a mass shelter site for residents from other parts of the state. And there were thousands of evacuees mostly from Southwest Louisiana that arrived to New Orleans by bus to shelter in hotels for free. And just about 4 days after the hurricane, there were over 10,000 evacuees here being accommodated in more than 30 hotels in the greater New Orleans area. Many people arrived with little more than the clothes on their backs, and the experience of being in transit and not being able to take many things made it very difficult for families to meet the needs of their infants and their young children. And another important thing to point out is that New Orleans has historically been an evacuation site. It's never been designated as a sheltering site before. Until this hurricane. So that means that the plans and the resources and the equipment needed to shelter in place barely existed going into hurricane season. So the first thing that we did was we launched a 24/7 emergency parent-infant hotline. And we activated this the night before the storm. And we saw this as a way of providing support to families with young children across the state that were affected by the hurricane. And the hotline was staffed by doulas and lactation counselors. And we collaborated with a local language justice collective so that we could provide interpretation services for Spanish-speaking families calling our hotline. And we sent our flyer out to everybody that we could think of. Contacts in our network, like the Louisiana Breastfeeding Coalition, state hospitals, other emergency response planners and managers, the New Orleans Maternal and Child Health Coalition, and then also just general community birth workers and lactation providers that are in our community. And over the course of 4 weeks, we had 60 people call our hotline, and people had questions on infant feeding, questions on where to get supplies like diapers and formula and clothing, and also where to access medical counseling or mental health counseling. And we also saw that the need for baby items was urgent. So within those first few days, we put out a community-wide call for donations. We asked for clothing, for baby, children, and adults, for new underwear, for diapers, for wipes, and also menstrual products that we could then distribute to evacuees. So within days, the city of New Orleans set up a really wonderful resource center downtown to support evacuees with supplies and services. You know, there was clothing and food and medical care. And initially, we participated in the resource center by distributing the donations of clothing and other items that we collected from community members. And in the first 72 hours or so, when we were on site, we made a few observations. The first was that when we were at the resource center, we had approached somebody and asked how many families with children under 2 were being accommodated in the shelters, and nobody was able to give us an answer. We also noticed that it wasn't really apparent that there was any central organization taking the lead on distributing formula. And we also were noticing that formula donations were being requested and accepted, and that goes against international code, according to the World Health Organization. And we were even approached to distribute formula, but we politely declined. But what we did do was recommend conducting feeding assessments of families with children under 2. And we suggested this because we know from the literature that in an emergency, formula should only be supplied to families based on an assessed need. And that's not what we were seeing. We were seeing just blanket random distribution. So we volunteered to become involved in that way. And that was the second way that we participated in this response. So we took a tool from Save the Children's IYCFE toolkit, and it's a rapid feeding assessment tool, and we adapted it. And we used it to collect the feeding histories of families with children under 2. And we talked to families that were visiting our table at the resource center. And at this table, we had our hotline flyer, we had some of our infant ready bags, and then we were doing these assessments. And so families that told us that they were breastfeeding received infant ready kits. And then formula feeding families, we directed them to the table that was distributing formula, and we encouraged them to enroll in WIC for long-term support. And we also handed out flyers for our hotline where people could ask any questions. And during the first 4 days of the resource center, we were able to speak with and assess close to 50 families with children under 2. And when we looked at the initial data, we saw that the large majority of families were feeding their babies formula. 85% of these families. So only 15% of families were breastfeeding. And what's more is that there were about a handful of these families that with newborns that were born prematurely, and those babies were receiving powdered formula. And we know that giving premature babies powdered formula in an emergency can be extremely dangerous and is not recommended. So there was no system for capturing these particular families' needs. We also observed that families were receiving formula, but they weren't receiving any supplies to go along with that to prepare and use formula safely, like dish soap or feeding cups or a bucket to wash things. And it was unclear which families were receiving liquid ready-to-feed formula, and if they were, how that was being determined. So basically, there wasn't a specific process. And after that day, we did the assessments for about 4 days, but we couldn't continue after that just because our resources and our capacity were extremely limited. But these initial findings had our wheels turning. So about 4 days after the hurricane, the resource center ran out of formula, and the entire city there was a shortage. And it took close to 2 days to restock formula at the resource center. And this was a really critical point for us because we had already seen very low rates of breastfeeding in the population, which we were aware of, but we didn't realize the contrast was so stark. And so we felt like we needed to readapt our response, our approach, and we had to focus on meeting the needs of these families. The perfect scenario would be for a lead organization to hold the charge of purchasing formula, distributing it based on needs assessments, but that's not the model of U.S. disaster response. In the U.S., we rely on donations. And so community members had been offering us donations left and right. And we knew that accepting donations in an emergency is not what you're supposed to do. That's what violates code. But we felt like we were in this dilemma. And we sought advice from an expert in the field, and she, we decided to take a harm reduction approach. She reminded us that it's not unethical to assess need and distribute formula donations based on those needs. What's dangerous is distributing formula donations at random without doing anything to reduce risk. So we thought, okay, well, donations of money would be the best possible scenario so that we can then purchase the appropriate type of formula and the supplies to go along with it. So we applied for emergency funding, and we received a grant, and we created what we called safer formula feeding kits. And that's what these are. With funding, we were able to include a bucket, which could be used to wash supplies, 2-ounce bottles of liquid ready-to-feed formula, which is the safer, preferred type of formula in an emergency, especially when there are any concerns about access to clean water or electricity. We included liquid dish soap to clean any feeding supplies. There was a bottle brush in there as well for cleaning, a mesh bag to hang dry any feeding supplies to prevent contact with possibly contaminated surfaces, a bottle of hand sanitizer, medicine cups for feeding, a face mask or two for COVID prevention, and then the same educational booklet with essential teachings on safe infant feeding. So the idea was that we would conduct feeding assessments and distribute these buckets based on need. And we didn't have a direct system for follow-up or medical monitoring or anything, but we provided our hotline information so that families could call us with any questions or issues. So after several weeks, we were able to roll out a batch of 100 kits, and we distributed them in early October. So the back of this photo on the left, you can see we had bucket kits on the table, as well as our infant-ready kits. By this time, there was much less traffic at the resource center, and evacuee families had started returning home, but we were still able to distribute a good chunk of what we had. I do want to point out here that, formula cans on the table, labeled and branded and in plain view, those are also a code violation, but we were all doing the best that we could in much less than ideal circumstances. So we learned a lot from this experience, and through our observations, we developed very specific recommendations for our state and local health departments and emergency response agencies. And some of these recommendations are also based on the experiences of other partners elsewhere in the country that are doing similar work. So in terms of state emergency response, we think that infant feeding questions should be added to any intake questionnaire that's used at shelter and evacuation sites. And evacuees should be asked if they have a child under 2 or if they're pregnant. And if they are, or if they have a child under 2, ask them how that child is currently being fed. That way, we're able to track these at-risk populations for care and provide them with the appropriate resources and supplies that they need. We also see the value of developing an emergency IYCFE team. So this would be a team of infant feeding responders that would report to a sheltering site once they're notified that a family with a child under 2 is sheltering. And these responders would be in charge of conducting feeding assessments and also providing any support or supplies. We also recommend following international guidance for formula management and distribution in emergencies. Having a formula provision plan in place before an emergency is extremely important. We also don't want to compromise breastfeeding and chest feeding relationships that exist in families, because when formula is widely available, people will take it, and they may switch to formula feeding when breastfeeding is the safer option. And so we just want to make sure that things aren't happening haphazardly. And safe feeding supplies should be ready immediately upon sheltering. There should be pre-existing, pre-approved purchase order lists that are ready for items like wipes and diapers and menstrual products and formula. And lastly, one of the biggest lessons that we learned was how difficult and tiring it was to take care of ourselves and our families, as well as our communities in the aftermath of the storm. New Orleans was not in the eye of the storm, but we were still dealing with heavy rainfall and wind gusts and uncertainty. So it was hard to attend to our own needs and also extend support to the community. So we would love to see lactation professionals and birth workers, just perinatal professionals in general, partner and reciprocate support in times of emergency. That way, when a disaster hits, the perinatal workers in the affected communities don't have to be the ones providing support. So that latest reflection brings me to a more recent and fresh event that occurred in New Orleans, and this was Hurricane Ida. And Hurricane Ida struck New Orleans on the 16th anniversary of Hurricane Katrina. It was a very powerful storm that wiped out the entire city's power grid for several weeks. And as I mentioned, one of the biggest takeaways from our experience in Hurricane Laura was the importance of partnership. So when we first caught word that Hurricane Ida was headed our way, we talked about the necessity of activating our hotline again because it was very successful the previous year. But we also knew that based on our experience, we probably wouldn't have the physical, the emotional, or even the technological capacity to run the hotline because we had a Category 4 hurricane headed straight for us, and many of us were frantically getting our things together so that we could evacuate to other states. So on a whim, we connected with an organization called Mom to Mom Global, and this is a nonprofit that dedicates itself to breastfeeding support and education and advocacy for military families. And I spoke with the executive director, and I wanted to find out if, her global network of lactation providers would be interested and available in staffing the hotline. And they happily agreed, and they were so enthusiastic about it and excited to help. So once again, we activated a hotline the night before the storm. Trained lactation consultants staffed the line, and there were quite a number of Spanish speakers in the group that were able to sign up as interpreters for each shift. And so that any language access issues were covered. And over the course of 16 days, we received calls from 35 families. And like before, there were, a handful of people that called with, very specific issues on infant feeding, but the large majority of families needed information on where to get resources, like diapers and formula, once again. Also information on where the food distribution centers were, where can I get water, where can I get ice? And other families had called us, families that were residents of New Orleans but had evacuated elsewhere, and they needed support finding a lactation provider in their new location, or an urgent care center, or a provider because they were due to give birth any day now. And it was a really successful partnership, and it showed us that this can work, and we are very ready to reciprocate in the future. A couple of days after the storm, we got a call from a nurse at a local hospital, and she was asking for infant-ready kits for some of their newly delivered parents that were being discharged from the hospital, just in the immediate aftermath of the storm when nothing was really functioning. And one of our members of Birthmark that was still in New Orleans at the time was able to drive across the city and deliver a dozen or so kits at the hospital. And one thing that stood out from what the nurse said was that one new parent was discharged and had to leave the hospital to drive 10 hours to where they would evacuate. She cried when she received the bag because she had nothing to express milk to, and now she could use the breast milk bags. So very simple, a very simple measure that was life-changing. Also, during Hurricane Laura, we had taken up collections of donations, but found that we didn't have the storage capacity or the person power even to receive and sort and distribute everything. So we kind of changed our approach on this time around with Hurricane Ida. So we thought that setting up a mutual aid fund would be an alternative way to support families facing financial hardship and in need of items. So Birthmark opened a mutual aid fund for birth workers, for pregnant and postpartum people, and we prioritized Black and undocumented people and Birthmark clients. And we were able to do this through funding from Imagine Waterworks and also individual donors. And within a few hours of of making this announcement, we had close to 100 people in the community apply, and we were able to give out close to $18,000 in mutual aid. We saw that diapers were a huge need, just as they were in the previous storm. Even just 3 days after the storm, even a week, 2 weeks after the storm, there was no information on diaper or formula distribution. And we were getting a lot of calls about that on our hotline. And early post-hurricane, there also weren't transportation services available for families to get things that they needed. So we partnered with CORE, which is a crisis response organization, and we hosted a diaper drive one day. We gave away close to 8,000 diapers and about 50 or so infant-ready kits, and we had the gracious help of volunteers to do that. And our emergency preparedness work after Ida was formally recognized by a city council member a few weeks after the storm. And that really adds to our momentum to keep doing this work because as more people are paying attention, especially people that have influence in decision making, then we know that this work will become a priority. One thing that we're trying to do during hurricane season when we're not in crisis mode is engaging the community more on social media and posting messages about emergency preparedness. So we're posting facts and spreading awareness about useful skills like hand expression and cup feeding. And for families that are feeding their babies formula, we're reminding them that formula feeding, there is a way to formula feed safely. So these are just some examples of some of the social media posts that we have, ways to prepare for a severe storm as a pregnant person, the benefits of breastfeeding in an emergency, and also tips if you're evacuating while you're pregnant. This is something that came up with a few of our clients. And these are just very simple, practical tips that are good to think about ahead of time so you can pack these things away so when it's time to go, it's not a last minute scramble. So where are we going from here? So after Hurricane Laura, as I mentioned, we documented everything we observed during that response, and we shared our specific recommendations with a really responsive team of emergency planners in our region and other stakeholders. And we discussed ways that we could improve IYCFE in our state. And we've already seen some beautiful progress. There was a WIC representative in one of our meetings who, after our meeting, advocated for developing an emergency preparedness policy that would allow WIC to issue liquid ready-to-feed formula without all the additional approvals during disasters. And so that was just really wonderful to learn about. We've also been designated as a community partner on a grant from the National Association of City and County Health Officials, and we're partnering with the Bureau of Family Health on this. And the premise of this project is building community resilience in our state to prepare for and rapidly respond to the unique needs of pregnant and parenting families. And a big part of this project is delivering trainings on perinatal emergency preparedness to emergency response planners and managers in our state. So by spring of next year, we plan to train close to 500 people, and we are halfway at that goal. And it's been a really illuminating training for a lot of people, and we've received good feedback. So we hope that people are taking what they learn and spreading the knowledge. And most recently, we were awarded a research grant from the Louisiana Clinical and Translational Science Center to conduct community-based participatory research. And we will be doing this in partnership with Xavier University. And we are going to do qualitative interviews with the families that we supported at the Evacuee Resource Center after Hurricane Laura, and explore how to best support IYCFE in a low breastfeeding population. So we're really excited to explore that. So I'll close today by saying that we do this work because we know that climate change has very unique effects on pregnant and parenting families. It has multi-layered impacts on infant health, on parent health, and on community health as a whole. And with disasters happening more frequently and more intensely, we need to plan better. And we need to respond proactively instead of reactively, and carry with us all the lessons that we've learned in previous disasters from decades ago. So I really believe that we can do better. I want to thank you for your attention. I have my email address here if you would like to get in touch, as well as our website. And thank you.
Thank you so much for that wonderful presentation. I learned so much, and also I think we underestimate the power of just on the ground basic needs assessment and addressing the needs of our families. So we super appreciate you sharing your experience. I don't believe we have any questions at the time, but we'll continue looking at the chat. A big thank you here. Lots of folks praising the good information. We do have an announcement. We had a bit of a glitch not being in the main stage, so we're going to make it easy for you all. Remain in the main room, the main stage the whole time. We are going to go into our first break here, and we'll be back with our next presentation around 2:15. So stay tuned for DJ Frankie J in this main room. Thank you.